of the things we really strive to do when we do facial fillers, PDO threads, and stick is we try to limit the amount of bruising, because everyone, think about your lifestyle. Everyone is so busy. We're all scheduled like 24/7, and just even a few days of bruising where you have to curtail social or business activities. A lot of people, that's a big problem, especially if you have a big job or you're meeting people all day long. To go in with bruises all over your face, is really a disincentive for people getting fillers. Or if there's a big event coming up, a wedding or whatever, it's just another reason to try to avoid bruising whenever we can. One of the things that we do when we do facial fillers is we use a technique, and I learned this from Dr. Arthur Swift from Canada. It's called 50-50 blending. And the idea is that we take HA fillers, which are the most common fillers that we use, Juvederm, Restylane, that class or that family of fillers, and by adding extra lidocaine to them, you do two things. Number one, you make the treatment less painful. Number two, you increase the amount of volume that you have for restoring facial volume. And that doesn't translate into the filler. You would say, well, if you do 50-50 blending, if you have that much lidocaine in there, it's only going to last half as long. But they've actually done split-face studies where they do 50-50 blending versus unblended HA fillers and find that the 50-50 blend lasts a month or two shorter than unblended, because there's something going on. There's active biological activity. We're creating collagen. Our body is responding to these fillers, and so it's not just based on the volume of filler, it's based on this metabolic activity. It's the other reason we also see improvement in skin quality when we do fillers. You'll see people that come in and their face is glowing because of the metabolic activity from the filler. So you get benefit on both ends.